Namaskar viewers, hello and welcome to Sunset TV. I'm Tina Jha, you're watching Perspective. Well, COVID is not over yet. We need to be alert and follow COVID appropriate behavior once again. The government has sounded the alarm amid a sudden spurt in COVID cases globally. Union Health Minister Mansukh Mandavia chaired a review meeting with health officials and medical experts, following which all states and union territories have been asked to ramp up genome sequencing. In a letter to the states and UTs, Union Health Secretary Rajesh Bhushan said such an exercise will enable timely detection of newer variants, if any, circulating in the country and will facilitate undertaking of requisite public health measures. Besides, he also highlighted that India, with its focus on the five-fold strategy of test, track, treat, vaccination and adherence to COVID-appropriate behavior, has been able to restrict the transmission of COVID so far. However, public health challenge of COVID-19 still persists around the world, with around 35 lakh cases reported weekly. So what has led to this sudden increase in cases globally, particularly in countries like China, Brazil, the United States, Korea and also Japan? How can we prevent the surge in India? This and much more in perspective today with eminent panelists who join us on the show today. Pleased to welcome Dr. Raman Gangakhedkar, Dr. C.G. Pandit National Chair, ICMR, Dr. Sunil Raina, Professor and Head Community Medicine, Dr. R.P. Government Medical College, Tanda, Himachal Pradesh, and Dr. Sunil Raheja, Senior Consultant Physician, and he is also the ex-MS GB Pant Hospital, Delhi. Thank you, gentlemen, for joining us on the program today. Dr. Gangakhedkar, let me begin the program today with you. You know, I recall at the end of 2021, we were discussing the Omicron scare. And of course, we recall how Omicron led to sudden increase in cases last year in the country. Now, as 2022 winds up, there's another scare. There is a sudden spurt in cases globally, this time in countries like China, in the US, in Korea, in Brazil, also Japan. Of course, there's an advisory and there's a caution that has been issued from the central government. But what do you suspect is behind this sudden spike in cases globally? Could it be a new variant?
I don't think it's a new variant. Whatever we are getting is from the same sublineage of BF.5. When we talk of BF, the new BF.7 variant, it's not a different variant, but it is that now the virus is undergoing what is called as convergent evolution. In convergent evolution, you will find that there will be multiple variants that you will see. None of them become a predominant variant because they do not have additional advantage that they will get in terms of transmission efficiency, because you have already peaked with transmission efficiency in Omicron. So essentially what will happen is you will see different sublineages of the same Omicron virus. The reason why perhaps this particular number is increasing as of now is due to two things. One thing is it was the Omicron variant was continuing to have more number of cases in USA, in Europe still. But these new places where it is occurring, let's say Brazil or the other countries at this juncture, especially China, the factor that is related with it is because of the zero COVID strategy being suddenly lifted in China. You are finding that people who are vulnerable with a variant that perhaps has the highest transmissibility, you find that the R0 value of this variant that they are currently having is close to about 15, which means one person can infect 15 people. You will find that the numbers would be very high in a short span of time because of high R0 value of this particular variant. The result is there will be a huge spike that you will see, which will last for a short period of time compared to what we had earlier in India of about 4 to 5 months with each of the waves that we saw so far. Now, which essentially means that there will be more new infections. China has also given Sinovac and Sinopharm vaccines, though their coverage rates are very high. If you recall that these two vaccines are inactivated vaccines, like we had Covaxin, but the most important difference between Covaxin and these two vaccines is we used a better adjuvant. which was a new adjuvant, but they were relying on older adjuvant as such, and their efficacy is lesser compared to all other vaccines. If you also recall that the vaccine efficacy was as low as 47%, as the data emerged from certain countries, and those countries refused to take those vaccines. So,
Fortunately,
what does it essentially
I
mean?
think that has what has helped India so far in battling COVID, Professor Rena. The fact that we can still say that despite, having such a huge population, we've been able to battle COVID so far into the third year. Our vaccination campaign is quite successful relatively. But the fact that at a time when countries are overwhelmed, their hospitals are flooded because in neighboring China, suddenly the cases have exploded. How concerned are you? Because it's just next door, and we've seen in the past how the virus can easily travel.
First, thanks for having me on the show, Tina. And as you rightly pointed out, because of the fact that the infection is in our neighborhood, we must realize the fact that anywhere infection anywhere means infection everywhere.
Right.
So if there is an infection in our neighborhood, there is always a chance that it can reach us. And probably that's why the directions have come to us with regard to picking up every positive case and sending it for genome sequencing, because that will be critical. Because if we are able to identify the variants, we will be able to control the future outbreak of infections to a level, to a large extent. But extending on what Dr. Ganga Khetkar said about the zero COVID strategy, primarily China suffered because of the fact that it relied heavily on a single strategy. And they were not able to optimize other strategies. For example, vaccination is something they could not optimize. In addition to the fact that they said that once we box in the virus, we will be able to take care of it. So in that sense, India is better placed. We are much wiser, much learned in the sense that we have always used a multi-pronged strategy. We are not relied on a single strategy, whether it's for vaccination, whether it's our COVID appropriate behavior. And also the fact that we are benefited from an advantage that we are not a very travel-friendly society. We are not a hugely travel-friendly society. We have a large rural population. That's something that could stand as an advantage in future as well. But we need to be cautious. We have to be cautious. We don't need to panic, but caution is something that I would always want to be advised about.
Right. So don't panic, but be alert. That's something that has worked for India, Mr. Raheja. The fact that, now there is this concern, there is a caution, the government has now sounded alarm. The fact is, we Indians sort of left COVID behind a few months ago. There are no guidelines in place now. There are no advisories. The testing numbers have dropped. And we are, especially in a season with the winter season, when we will have these mild symptoms of cough and cold. So what really is the way forward? Should we be concerned, and should we, hit the hospitals as soon as we develop these symptoms? Or is there anything else that we need to watch out for, and maybe then perhaps visit the doctor? What is it that you suggest?
I think the most important is that we need to be on the alert and step up our surveillance, but not to panic. That is very important, because as we have been discussing, if the government has already today directed, even yesterday our union health secretary and union health minister has already directed that any cases reported anywhere in India sample should be sent for the genome sequencing. So this is the very important step, well in time, because if we are doing the genome sequence, we will get to know any mutation going on in the virus, or any new variant coming up, or the variant of concern coming up. And accordingly, we can step up our public health measures. This is, I think, very, very important. And as we have already discussed, India is better placed because we have followed the multi-pronged strategy: test, track, treat, vaccination, and then COVID appropriate behavior. These 5 things have really saved us from the previous outbreaks. And I wish Indian vaccines are much, much better than what the Chinese are using. Chinese vaccines are all, this thing, inactivated vaccines. So what we see is Indian vaccines that way are very superior, and even Western studies are showing live mRNA vaccine and Indian vaccines are supposed to be better efficacy wise. And fortunately, all the population has been vaccinated well in time. Even the person below the age of 18 years are vaccinated. So our health ministry, government of India, under the leadership of Honorable Prime Minister, have already done a wonderful job. And I'm telling you, India has got the best vaccine facilities in India with compared to other parts of the world. Even difficult to reach areas, we could send the vaccine. So we can believe India is well prepared to tackle any situation. So I again repeat, there is nothing to panic. Only thing we need is to be on the alert mode.
But
And
Professor Rana,
whoever is coming
given that
from,
we keep asserting on the COVID appropriate behavior aspect, the fact that
Yes.
across the country the masks have gone away a long time back, is it time to make it mandatory once again? Should we, at least in crowded places, especially for the vulnerable population, should those guidelines be brought back?
Absolutely. I would suggest that masks should come back and we should emphasize on using high quality masks in all crowded places. So, all closed spaces, whether it's your offices, it's the schools, or whether people move out in crowded places, even if they are going to the malls, good quality masks should be emphasized. But not just masks, we should also start emphasizing on the fact that the ventilation of all these places needs to be improved. I think this pandemic has served us in one way. We need to understand that we need to create an infrastructure around us which is pandemic friendly in a sense that it doesn't give rise to chance of circulating viruses to infect us. So we should have schools which have better ventilation. We should have hospitals and buildings which have better ventilation. So probably emphasizing on both good quality of masks and better ventilation. In addition to the fact that if we are able to avoid travel, which is not necessary at this point in time, we should restrict that as well. These are probably something that we need to get back to, stick to, and maybe use for a period of time till we are really sure that there is no infection around us.
Okay, but Dr. Ganga Khedkar, another apprehension, and which is quite valid, which people have been asking is, and something that you also referred to in your earlier intervention was, that if we compare the India and Chinese vaccines, the question of efficacy is being argued about. But what about the other countries like the United States, like Korea, Japan? Large chunks of their population are also vaccinated, and with vaccines which have been reported to be efficacious. The fact is that their population is also now witnessing a surge of a kind that they've not seen before. Also, if you could, help us understand the trend with the rate of hospitalizations in these countries, the recovery and the death rates compared to the previous waves that these countries have seen. And in that aspect, how concerned should we be?
One thing which I would say is if you actually look at US and Brazil, their coverage rates were better for 2 dosages so far. But when it comes to third dose, you find that their older population continues to be not vaccinated with the third dose as of now. Now, second thing which is also important to understand, that these countries tend to have a large, significant population of close to about 25%, which is anti-vax. They don't accept any kind of vaccine that you tend to provide. And therefore, they remained vulnerable. And in that vulnerability, when the virus was evolving, virus in any case was not getting stopped by the vaccines from passing on new infection to others. Now, if that is the case, then there is an evolution that is going on. You will find that there will be more number of cases, but the risk of hospitalization and death is likely to be lower. Now, with respect to your question on recovery rates in this particular situation are going to be very high, mainly because you will find that Omicron, these are all variants from Omicron's lineages. The rate of hospitalization is less, the risk of death is less, and what is most important is the virus stays for shorter time in the body, and incubation period is also smaller. The result is the recovery rates will be higher, but the numbers are going to be pretty high. But the situation may not remain the same for China, because in China, you will find that their hospitals will have large number of patients coming for admissions per se, since the population that is vulnerable is very large and the vaccine that they have given is less efficacious compared to vaccines that are available elsewhere.
And also
And
the
they do
fact
not
that, you
have
know,
any
that
other.
there are reports, there are experts who are claiming that China is massively underreporting the cases and the deaths as well. Perhaps the fact that the real numbers will come up only after a few months from now, but for us, because we are next door neighbors, it's important to be vigilant. Dr. Raheja, in that aspect, because prevention is better than cure, and we've been speaking about how we need to be alert. The center has now issued guidelines to the states and the union territories to at least ramp up genome sequencing. But how do we need to equip our hospitals once again so that, you know, if there is a situation, if it arises that we have a spurt in cases, we're able to handle them effectively and not see something that happened during the second wave?
Yes, yes. We have to basically understand this new variant, Omicron subvariant BF.7 is more infectious than the other subvariants of the Omicron. But at the same time, it is less virulent. And the incubation period is also less. And this 0.7 variant has got immune escapability also, like it can dodge the immune system of the individual. So that way, this variant is going to spread faster than the previous variants, subvariants. But it is likely to be less virulent. And that is the point. As I already said, India during the previous uh, episodes of the COVID-19, like when the Delta variant came, we have already stepped up our hospitals, our dispensary healthcare system, and we have already trained doctors, nurses. So that way we are much well placed with compared to China or other countries.
You're right, but at the
So
same
at the
time, Dr.
same
Ganga
time,
Khedkar, the fact is that pandemic fatigue has also set in. This is the third year of the pandemic. So you tell people to mask up, and of course, I mean, as an individual, because when I travel in public transport, and if I put up a mask, people look at me and people stare me as if I'm from another zone. So to actually now bring back that kind of, you know, mask culture in the third year of the pandemic would be a little difficult until it's made mandatory is number one. And the second aspect is going forth, apart from the guidelines that the center has given, what else do you think should be our strategy to ensure that we, you know, keep the virus in control, no matter which variant it is? So apart from the upping our game on genome sequencing, preparing our hospitals, equipping the testing centers, at the same time making the people once again aware of how important masks are, what should be the best way forward to deal with this sudden crisis that has come up?
I think we will need to have a strong communication campaign,
Mm-hmm.
you know, for using masks. Masks are not only protective against COVID infection; it's against all respiratory infections. Everybody who is vulnerable tends to face a situation, whether it is influenza infection, whichever infection you tend to talk about, or respiratory syncytial virus infection. Now, in those circumstances, we have also got to tell them that if we use mask when we go to close spaces, you are going to protect yourself from other respiratory ailments, including tuberculosis, including, you know, pollution that tends to occur, tends to be seen. So this should be something which should be a natural part of our lifestyle. And second thing which we have to inform all everybody, that this has to become a mass movement, and it cannot be something which should be only legally punishable offense, and then people tend to run away from this. I understand there is pandemic fatigue, but there is a good thing that is associated with this particular BF.7 virus. One thing which we will have to realize, since the virus is highly infectious, the wave that will follow will last for a very short period of time. and the number of infections will be picking up very quickly in China. So it would be a story unlike what we have seen earlier. In India, we used to have people we used to have waves which lasted for 4 to 5 months every time. Here it could be perhaps 4 to 6 weeks time that the wave will last, which essentially means we have to tell people that now that this particular virus is almost likely to become endemic, it would be good for them to follow these precautions only for a couple of months' time. And that should be done. Second thing, which is important, you asked what we should do additionally. To my mind, if we want to safeguard our interest, we should also ensure that the Paxlovid, the drug that is available, perhaps we should ask our generic companies to approach the innovator or try to get it from patent pools and
Yes.
try to manufacture just in case if something goes wrong, we would have a drug which would be powerful, which works against all variants.
Clearly. So the bottom line is vigilance without fear is the way to go forward for India. But at the same time, we have to be well prepared, well equipped, and at the same time, follow all appropriate COVID behavior in order to, defeat this virus and or put to rest all kinds of apprehensions that have been doing the rounds ever since the news has broken. But with that, I'll have to wrap up the program. Thank you, gentlemen, for joining us on this edition of Perspective, sharing your thoughts, your views, your suggestions with us and our viewers. And to you viewers, thank you very much for your time. At the same time, a caution that stay alert, be vigilant and follow COVID appropriate behavior, because there's a sudden spurt in COVID cases globally, and because of which the center has now issued instructions for all of us here in India as well to follow all these necessary precautions. So with that, it's a wrap on this edition of Perspective. I'll see you same time tomorrow now. Take good care of yourselves and your families and keep watching Sunset TV.